This is an isolation room at Dunedin Hospital. It's where a patient presenting with symptoms of the Ebola virus would be contained for assessment and treatment. Southern District Health Board staff are hopeful it won't need to be used to deal with Ebola victims, and they have a couple of messages for members of the public fearing for their safety.
The risk of Ebola coming to New Zealand is extremely low, so you shouldn't be worrying about things which are unlikely to happen. And the second message is, if Ebola does come to New Zealand, then we are ready to deal with it and to deal with any cases and also to protect the public and prevent an epidemic here.
Dr Reid told 39 Dunedin News that while the risk of Ebola coming here is low, it's not zero. For example, it could be carried by an international visitor arriving at the airport.
The other possibility is that someone who has entered the country from the affected area and was healthy at the time that they arrived in New Zealand becomes unwell during their stay here and then seeks medical assistance. And in that case, we've got a series of protocols as for how to get them to an appropriate place to be assessed.
Protective gear is on hand for staff as well. While new equipment will arrive in the coming days, Dr Reid says the gear is perfectly suitable for dealing with Ebola victims. He says the new gear has cost the SDHB a little under $3,000, but he believes it's well spent to help make the region as prepared for Ebola as possible.
We are confident that we have access to the appropriate equipment, which is to the Ministry of Health standard, and that the staff are being trained up in the use of that so that they will be confident in using that should a case arise.
Any Ebola patients dealt with locally would be taken to Christchurch. But as it spreads through contaminated body fluids, SDHB staff say it's unlikely to come to that, given the safeguards in place locally and nationally. David DeLorean, 39 Dunedin News.